Medicare facilities emerged from its festivities with a full house, taking them back to work as people seek care for multiple conditions. At the busy Kanifing General Hospital, Chief Executive Officer Basiru Drame said personnel on duty all returned to work and were present on the ground during Eid to deliver healthcare services. The hospital CEO hailed the department and unit heads for efficiently organizing the process.
The beauty of Kanifing is that before we go out of office, we call all the head of departments together with the head of units. We all sit down to strategize exactly what we want to do or how we want the units to function or how we want the hospital to function. So everybody will put mechanism in place to ensure that there is always continuity of service. So currently, myself, I even went around during my morning round. I went around and I realized that people have all reported back to work.
It wasn't busy as usual at the hospital this Monday, as there was no report of any post-Eid food poisoning case compared to previous public festivities, when there are usually many reported food poisoning cases associated with eating a variety of foods, given little or no consideration to its health impact.
No case of food poisoning was actually reported to me by the people who were working here. There is no, because usually when I go around, I always ask them about the concerns or difficulties. So those things have not been reported to me, and I even went to the wards. There is no case of that being reported to me. So, meaning so far we did not receive any form of food poisoning in the hospital. And we also want to appeal to people that sometimes it's not always easy in the public facilities. So when they come around, please they should actually be patient with us. We tend to subsidize the cost or maybe the service to people to the best of our ability.
It is a moment of celebration, with Muslims around the world preparing a variety of delicious meals for the day after fasting for a month. Feasting on the great diversity of food prepared during Eid leaves children, especially vulnerable people, to gastric conditions that stay on after festivities. The hospital administrator, Babakar Sen, said the staff at the Kanifing General Hospital are disciplined and well-oriented in tackling health issues emerging from extensive inner-city catchment areas around Kanifing City and its satellite towns.
We believe that the Eid or any social event should not be an excuse for disruption of services or laxity in the provision of services. So we had a meeting with them, and all the units were tasked to look at some of the issues in their department. For example, if they don't have enough supplies, we replenish. If their equipment or machines were down, we repair. So those are the things that we discussed. But what we emphasized also to them was the need for staff to report to work on time on each day and close on time.
A key issue being advanced here to boost community health care is nurses' attitudes towards patients.
What we expect is that when patients or clients come to our facilities, they are treated with respect. And whatever the service provider is supposed to do is done in a professional manner. We've been hearing instances when there will be problems between the patient or sometimes it's escort. It's not usually the patient, it's the escorts. But what we always tell the staff is to de-escalate the situation as much as possible. It is not ethical for a service provider to quarrel or have a problem, with the patient. So that those kind of incidents never happen here. What do happen sometimes is the escort, because they come, they bring their patients, and maybe they've waited for them a long time, not realizing that our staff are overworked. They have a lot of patients to see. So some of them, maybe out of frustration, will want to assault, sometimes verbally and sometimes even physically, our staff. Why are they kept waiting?
Health officials here at one of the country's leading hospitals have indicated the desire and commitment of the hospital staff in delivering quality services to patients. For the news, I am Isatou Jatta.